Epilepsy is a disorder of recurrent unprovoked seizures. Now, seizures are manifestations because of altered brain activity. Epileptic seizures mean the disturbance begins in the brain, whereas seizures can also be a response to, for example, anoxia or hypoglycemia. There are many different types of seizures, but epilepsy is broadly classified into generalized and focal types of epilepsies. Generalized forms of epilepsies have electrical disturbance starting at all parts of the brain together. Now, these could manifest as tonic seizures where there is increased body tone, or tonic-clonic where there is also jerking, or atonic seizures where a person suddenly loses tone and falls to the ground, or myoclonic seizures which are very fast twitches or absences where a person can be staring blankly, or infantile spasms which are sustained spasms for a few seconds, either flexor or extensor type. Now, focal onset epilepsy can start with disturbance in the temporal lobe, frontal lobe, or occipital lobe, each of those giving rise to different manifestations at the onset. Now, focal epilepsies can be simple when the consciousness is retained, or complex where there is impaired consciousness, and some focal epilepsies can have secondary generalization. There are many causes for epileptic disorders, but majority of them are idiopathic in nature. People with epilepsy can have underlying genetic disorder like tuberous sclerosis, neurofibromatosis, or storage disorders. They can have structural brain abnormalities like cortical dysgenesis, mesial temporal sclerosis. They can have infections in the brain like brain abscess, encephalitis, cysticercosis, or inflammatory disorders like vasculitis, multiple sclerosis. Seizures could be a manifestation of trauma or tumors or cerebrovascular disease like stroke. But seizures can also be secondary to metabolic impairments like hyponatremia, hypocalcemia, and hypoglycemia. Diagnosis of epilepsy is mainly clinical, based on a detailed history of a seizure. We take a detailed witness account and ask manifestations just before a seizure, how it all started, what was happening during a seizure, and how the seizure stopped, and description of post-ictal phase. If people could provide video evidence, that is very helpful to make a diagnosis. We'd also try to elaborate precipitating factors and exclude differentials. Sometimes we do blood tests and ECGs to exclude differentials. A CT scan or MRI of brain is often used to look at underlying structural brain abnormalities. EEG is commonly used for classifying epilepsy, but EEG can have false positives and also false negatives and has a low sensitivity. This means EEG is not a test to exclude epilepsy, but if there are EEG abnormalities, those are used to classify the epilepsy disorder. Management of epilepsy requires specialist advice to initiate or discontinue medications and to monitor the seizure control. Commonly used drugs for generalized tonic-clonic seizures include valproate, lamotrigine, or levetiracetam. Focal epilepsy is treated with carbamazepine or lamotrigine. Absence epilepsy is treated with valproate or ethosuximide. People also require lifestyle advice, for example, safety in swimming pool, in bath, riding a bike, advice on employment, advice on driving, and many other lifestyle advices, for example, impact of drugs and alcohol and sleep deprivation. Very rarely, surgery is also used in people with epilepsy, either to cure the seizure, if they, for example, by removing a lesion, or to reduce number of seizures by using a vagal nerve stimulator.